All right, hello everyone. So my innovative educational software tool that we're going to look at is Visible Body, and so Visible Body is a it's a web-based but also application-based, so you can have it on a mobile phone or on a tablet. It's a web and application-based anatomical software tool that is used by undergraduate students in anatomy and physiology courses. It can be used at the graduate level as well. So maybe some type of biomedical science program, graduate program, medical schools, dental schools, PA schools. These are all different types of graduate programs that are utilizing Visible Body and then other software tools like it. It offers students and educators alike different ways to approach anatomy. And so, for one, it offers a systems approach, right? So, this is an approach that is used by many undergraduate institutions when teaching anatomy. So, you look at the individual system, so the integumentary system and the skeletal system and the muscular system and so on. However, it also provides teachers and students a regional approach to anatomy. So, as opposed to looking at an individual system, so just the skeletal system, you may look at the upper limb as a region and then all of the systems within that region. Invisible Body is able to provide that view, that approach to students and educators. And lastly, it allows for both a gross anatomy perspective and a gross anatomy view, and also a microanatomy view. So you're able to look at large gross anatomical structures, either as a systems approach or as a regional approach, as we just mentioned. However, it also offers the ability to look at microanatomy. So you can zoom in and maybe take a closer look at some structures of the lung, right? So maybe you can view the alveoli and various small structures in the lung. You may be able to look at small structures in the kidney, like the nephron, things like that. So it offers multiple different views and multiple different approaches for students and educators as they are teaching or learning anatomy. The cost for Visible Body, it really depends on how the software tool is being accessed. So that being whether it is accessed via an individual student or if it is accessed via an educational institution. So it's offered both. So you can purchase it individually, just you, and it usually is $25.99 as an app. So you purchase it one time, and it's $25.99, and you have access to that on your mobile phone or your tablet. You can also purchase it via an institutional subscription. So maybe your university or your college wants undergraduate students to learn anatomy or to take their anatomy course using Visible Body. Maybe the number of anatomical models are deficient in a biology department or something like that. So you can use Visible Body, and it is usually around $150 per year per device. So per year per device for the students that are going to be using that software in their education. Now, it offers multiple different uses and benefits to the user. So for the students, one big one is it offers benefits to both visual and kinesthetic learners. And so visual is, and as I will show you in a moment, it is a very visual software, and so you get many different views of anatomy. As we said, you can look at it regionally, you can look at it systemically, you can look at the gross anatomy, you can look at the microanatomy. And then also for kinesthetic, although it's software on a tablet or on a phone or on a desktop, the way in which you're able to manipulate the anatomy is really beneficial for kinesthetic learners. It enhances creativity. So on Visible Body, students are able to add and remove different structures, whether you're looking at a systems approach or a regional approach. Students are able to add and remove these different things. And as a result, they're able to create a very unique view of whatever system or whatever region they're looking at. And they're also able to share that view, save it and share it with a peer or perhaps with their instructor. Students also are able to recognize relationships between structures. So this is especially important when looking at the regional approach on Visible Body, as we will see. Students understand where arteries and veins and nerves are in relation to each other. They're able to see how muscles attach to bones via their tendons. They're able to get a better relationship or a better appreciation for the relationship, as opposed to looking at it maybe on a static image on a textbook or a screen or something along those lines. And then lastly, Visible Body offers students clinical correlates for each of the different systems in each of the different regions. And so as we'll see, when you click on a particular structure like a bone or a blood vessel or a muscle, you're also able to see various clinical applications of that structure. So how is this structure, how is this blood vessel, how is this muscle interpreted, or how is it often seen in a clinical type of setting, right? So as we'll see, if we come over here and look at our Visible Body, one educational kind of training or topic that could be presented in my setting, so teaching undergraduate anatomy and physiology, are blood vessels, especially those surrounding the brain, right? So with Visible Body, you have a number of different features. As you can see on the bottom, you have a row of various tools. It is on the application-based system. So for a phone and tablet, you simply touch and you can zoom and touch. And when you touch a structure, it identifies it. So you can see in the top right, this is the internal carotid artery. You're also able to read a little bit about that vessel, right? So maybe what the vessel is, what does it do, what are the different parts of it, what does it connect to? And then you can also see any clinical correlations, right, related to blood vessels and maybe specifically related to blood vessels in the brain, right? So maybe talking about a brain aneurysm, right? An aneurysm of one of the blood vessels in this circle of Willis surrounding the base of the brain. Maybe you're interested in learning a little bit about stroke. So what happens if we have an occlusion to one of these blood vessels, or perhaps we have a hemorrhage, so we're bleeding. What are different things? And students are able to read through this and get a better idea of how this particular structure is seen and how it is interpreted in a clinical setting. So with this circle of Willis, it's very easily manipulated by both the instructor and the student, whoever happens to be doing it, and simply clicking on the vessel identifies it, right? So if we're looking at the internal carotid artery, we know that we start with vertebral arteries and internal carotid arteries. So here's our internal carotid, and you can trace it up through its various parts. We can come down here and take a look at our vertebral arteries. We know that the vertebral arteries on either side merge and form the basilar artery in the middle, right? And then from there, we begin branching further. So we have our posterior cerebral arteries. The good thing about Visible Body, especially for blood vessels and other structures that are very difficult to see on an actual specimen or see on a model, is you're able to zoom in very deeply and get a very nice view. So if we want to zoom all the way in and see the posterior communicating artery, right, we can click on it. And then we can also zoom out and see where that structure is in relation to other structures, right? So we can continue following these to the middle cerebral, to the anterior cerebral here. We can look at the anterior communicating, and students are able to easily click on each structure as they are working their way through, as they are studying each system. And again, they can click, they can identify and read about what they are seeing on the screen. They can see any clinical correlations. They're also able to click the audio button and hear a pronunciation of the word. So we know that some medical terminology, some anatomical terms are difficult to pronounce. So Visible Body offers them a way to practice pronouncing, but also perhaps spelling various terms if their course requires them to fill in blanks on exams they must be able to spell, right? And so there are very good resources with Visible Body. Again, you can easily manipulate structures. Now, an additional structure or an additional function that Visible Body has is the AR that you see in the bottom left, the augmented reality function. And so students are able to, if they have the mobile version, if they have the version on their phone or their tablet, they're able to click the AR, they're able to project the structure into their living room, into their dorm room, into the library, wherever they happen to be learning it. And they're able to manipulate and see the structures in a little bit different way as they're able to walk around, maybe get inside the skull. They're able to get a better view and a better appreciation of the anatomy whenever they use the augmented reality function, right? So this is Visible Body. Very useful, very helpful tool for students and educators alike for anatomy purposes.